And my mantra as a nurse practitioner, as a mom, it's like we always feel like we could be doing more. And as parents, we're always, we always feel like we're maybe falling short. Like, and there's a lot of like, again, with the diagnosis, like, oh, we should have done this, or, is it because I took this medication when I was pregnant? You want to go through all the, could have, would have, should have. And like, it's important to just come to a place of like acceptance and say, okay, this is where we're at. Hold everything very loosely.
Welcome back, everybody, to another episode of Autism Life Today. I'm so excited for you to join us again. And today we have another amazing doctor to bring you some more info and insight into this crazy world that we call autism. So I'd like to introduce you today to Dr. April Lamb.
Hi.
Hey, thanks for coming down here and chatting with us.
Thanks for having me.
Yeah, it's a pleasure. For you, how did you find yourself in the naturopathic route? How did that begin for you?
So, and just to clarify to our listeners, I have my doctorate in nursing practice. So while my title is doctor, I am a nurse practitioner. I've specialized in family medicine, and how I got into naturopathic medicine is, as nurse practitioners, we have to find our own rotations. So for our preceptorships, so I had to cold call a million clinics. And
as opposed to doctors not having to find their own?
Correct.
They're kind of set up for them?
Right.
Really?
So you are on your own. Most schools say good luck. And so I serendipitously just happened to contact a naturopathic office out in Mesa. And Dr. Kristen Bishop was so gracious to take me on as a student. She's like, well, we've never had a nurse practitioner before, but yeah, if your school's cool with it, yeah, we'll take you. So I did 2 years there with them during my schooling. And then I ended up one of their clinic directors as they expanded their practice in Phoenix. And I was their clinic director there for 4 years before I started my own practice.
That's awesome. So when you were going down that path, obviously originally it was just to be a nurse. What urged you to go that next level? What gave you the itch that said, you know what, I'm ready to go one next step, level up?
Yeah, good question. Really the autonomy, because I saw so many patients that needed more care that weren't getting care. And as an RN, we have to get our orders from doctors or, nurse practitioners, mid-level providers. And, I would see patients that were struggling and I'm like, man, I know that they need this or that. And I couldn't do it. I have to call in, wait for an order. So I thought, I really think that I have what it takes to be in that position. And really, I just wanted to be able to help change the system a little bit, because especially in the medical system, we would kind of ticky-tack people together, especially in the hospital system, get them just well enough to get out, and then they'd be back in. And so I'm like, how can I be more proactive than reactive in my role? So that's kind of what got me into, functional medicine, naturopathic medicine, and going that next step into the nurse practitioner route.
Yeah. I love this stuff so much. Like I always call, when I example, is like root cause, symptoms.
Right.
Which one are we, like I'll say 1,000 times, if you get in a car accident and your arm is broken, there's no better country in the world that you want to be in to get put back together than an ER in the United States of America. We are it. We are number one for acute care.
Right.
If you've got something that is deeper, that is asymptomatic sometimes, that is some type of autoimmune disease, we rank like 30th or something like that. We ain't doing great. So it's the types of practices that you work in and what you do that's so awesome, because it's like, hey, let's try to figure out what is really going on here, because I don't want you just come back. Because obviously you were in both worlds. So when you, what was that switch like for you when you finally got to go from hey, here's 3 minutes to this is the drug to.
Right. So, I'm a little spoiled in that most of my practice, I would say all of my practice, I got that 30 minutes to an hour with my patients.
Oh.
Because I started right into functional medicine out of school, out of my nurse practitioner program. So, but what I would see is I would get those patients that only got the 3 to 5 minute appointments, or their care had been so fragmented. They had been passed off to so many specialists that I was able to keep them in-house and say, I can take care of everything here. And I can talk to you about more than one problem at a time. And so being able to do that, it solidified in me, I don't want to work in that system. I think we need to change it. So, I mean, it's hard to change it from the outside, but I was like, I can't function. I wouldn't be able to function. I'm too spoiled in what I do currently. But yeah, I think that is, I wish that more providers could practice that way. And unfortunately, the powers that be in the corporations really, it's not the providers that want to practice that way. It's the people that they work for.
It's the system for sure. It is built to be a certain way. So even a doctor with the best of intentions, it's almost like they're hand strapped. I know. And I've heard that too, that like you'll have a doctor who will like quietly on the sidelines agree with you on 9 out of 10 things.
Right.
And they're like, but I can't.
Right.
Because insurance
right.
and money and the ability to continue on goes one way. How did autism come into your life? How did that become a part of the picture of Dr. Lamb?
So my son is on the spectrum. He, I kind of picked up that he wasn't developing typically when he was about 2.5 years old. We didn't have like the, stereotypical regression or anything like that, but it was just like things weren't quite adding up. The play was more parallel. He was lining things up. He was very particular. There were a lot of meltdowns, those kind of things.
How old is he right now?
He is 13 now.
13 now.
So 10 years ago,
okay, so
he
10
was.
years ago, okay. So still enough of a time period where there wasn't as much info out there. It was definitely a period where you as a mom had to seek out. It wasn't on every corner. It wasn't on every news outlet. You were very much so like going like, hey, something is not right here.
And I had been a nanny prior to being a nurse. And so I kind of had enough experience with kids to be like, he was very social. He made eye contact. He didn't hit all of those, stereotypical, but there were just some things like with his speech and things that were off. So initially when I took him in to get diagnosed, his pediatrician kind of blew me off and was like, well, he's talking. I'm like, but he's scripting. He's not conversational.
Yeah, it's not interactive.
Right.
Yeah.
And yes, he's social. He loved spending time with people. He'd look you in the eye. But there were just some things where I'm like, I really had to push for a diagnosis. And I actually ended up getting his diagnosis through a telehealth platform called NODA, Natural Observation Diagnostic Assessment. They were brand new. They were able to get us in within weeks instead, because it was at the time it was about a 9-month wait. And I knew,
easily,
the window was, that neuroplasticity, we can go into that later, but that window was closing. And at the time I was an RN, I wasn't an NP yet. So getting that diagnosis was so important to me because it opens the channels up for the resources. And so that was really kind of my main goal, is let me get this kid as many resources as possible to support him. And then that's been my goal with my patients.
I want to stop you there a second, because you're saying something really big. This is important, everybody. You need to hear what Dr. Lamb's saying here. I've heard this so many times from parents, especially with like the higher functioning kids. I don't want him or her to have the diagnosis. You be very careful by what you think you don't want from like your, hate to say it, but from a point of pride. And we've all been there. So don't think I'm casting a stone in your direction. Be careful about that, because if you don't get the diagnosis, you don't pass go and you don't get any of the help and the services. So if you truly believe that 100% it's just barely on there, maybe, and they grow out a year from then, it's no. And I've heard stories like that where they think they are, then a year later, it's totally not. But if there's a good chance and you're checking out of the 10 boxes, if you're checking 6, 7 of the 10 boxes, please,
1,000,000%.
Listen to her. Please do what it takes. I know sometimes the waiting list is long. Get on the waiting list, because if you don't have it, you can't get all the services. And like in Arizona, most of them are free. Some states have more or less, but this is important. By her fighting for that, it opened up the window for him to get all these.
Right. And that's part of what I do as a provider, even with the patients that I see now. Some of the parents, maybe they have a developmental delay diagnosis, but it's pretty certain. And I encourage parents, I'm like, get the diagnosis, because even your ESA amount, your empowerment scholarship amount,
bingo,
triples.
Bingo.
And, you know, people don't realize that. And the way I found that out, and this is kind of touching on this too, is through the community of other parents whose kids were on the spectrum. And if it weren't for them, I would have had no clue. So really, like, plugging into that community too is so important.
Yeah.
Because those people are a wealth of knowledge.
So good.
And if it weren't for them, I would have been completely lost.
Yeah. Another one, just touch it 'cause it's a hot button. I know it's your baby. So this is hard for people to hear. But when you go to do your evaluation, wherever it may be very careful to not all of a sudden clam up. And when they ask questions about, well, how bad is it? Well, you know, she does it every night. Don't do that, because the job of the evaluator is just like an insurance adjuster. Their job is to tell you no and give you nothing. That is ultimately their job. They're lots of times a government. And so if you don't paint the picture of worst case scenario, you don't get your kid the help they need. So I tell parents all the time, when you answer it so truthfully. Like, hey, biting, hitting, scratching, head banging, knocking sister down, tears this up, has a meltdown over this, can't get him off the ground for 30 minutes. Be very on, and I get, and what's worse about it is, and I'm a parent, what's worse about it is most of the time they're in the room with you. Yeah. And I know what that feels like. Yeah. It's a gut punch, because you're like even if they're nonverbal, they still are listening. Right. They still hear it. So like you have to do that. But to get past that, it opens windows that you really need a lot of times. So very important. Yeah. So I know that, as you understand as well. So he's 13 now. Yep. And for him, his trajectory, what was it like for him growing up? Where was he falling as far as like schooling? What was that like for him and his path?
Yeah, I mean, we were so blessed. He initially ended up at a public school for kindergarten, and his teacher happened to have a son on the spectrum. Oh. And he had been through their developmental preschool, again, getting the services early. So he was already kind of integrated into the program at the school. Unfortunately, he wasn't getting enough services in terms of, like, they get like 20 minutes of speech once a week if you're lucky.
It's very little in school, yeah.
And because of the other moms in the autism community, they were like, hey, do you know about ESA? No, tell me about that kind of thing. We were able to get him into a more specialized school where all of his therapies that he wasn't getting in the public school, OT, PT, that wasn't being offered at the public school, was offered at the school. And that really, between his kindergarten teacher in the public school working with him because she understood what it was like having a kid on the spectrum, and him getting into this more specialized program, was like a huge, it was like a huge opportunity for him. I think that had he not had that, he wouldn't have been as well-rounded as he is now.
I love that.
So I'm a big proponent for, like, get all the services, get all of the things that you can. It can feel very overwhelming, but there are people and organizations such as yours that can help parents navigate that. And it's a lot better now than it was. And I hope it's going to continue to get that way.
I agree. I hope it does too. And, you know, once again, your time period and my time period wasn't as at that time. And I'm not saying it's exactly like that now, but I don't feel like it's jumped that much. But the public school system, not trying to knock it, but the whatever, the finances, the hiring process, whatever it is, they just don't, they got a whole school to run. Yep. So it's not the focus, right? You know what I mean? Like, it's a squeaky wheel, but it's not the focus of the school. So if you want your child to be at the center of the focus, in most cases, you got to move them to a special needs school. Yeah. And there's a ton of them now. And Arizona's got them a ton. I imagine most states, if you look, have them as well. ESA is not in all states. So for those of you listening to this, I want to clarify what we're talking about. ESA is a program like a decade ago, I think, or so, that was voted on and passed, where basically they decided, and I may say this not 100% correct, but it's close enough. They figured out the number of what it cost the state to pay for your kid to go to public school. And at that time, or whenever it was about $14,000 is what your kid costs the state. So if you have a neurotypical kid you got about $7,000, somewhere like that. They didn't half. They said, if you want to go and take the money somewhere else, I'll give you half. So it was a win-win. They voted, it got voted in because both sides agreed on. They're like, okay, we're going to save $7,000 on one side, and then the other side, you can take it. And then schools found a way to make it work. Like they adjusted the ratios and they did it. So when we talk about ESA in Arizona, we have a really cool program. Now, if you have a special needs kids, like Dr. Lamb said, it's like 3 times that. And the number can vary based on the severity of your kiddo. So there's some numbers that are done there, but it's pretty amazing where you can get $20,000, $30,000 to send your kid to a special school like her son gets to go to. And once again, now he's the focus. Now he's the center of the learning circle.
Yeah, that's why that diagnosis is so important. I'm like, they're always going to be your kid no matter what. The diagnosis is a part of their story. It's not their whole story, but it opens up opportunities for them when you get it. So it's really important.
Did this play a big part in your journey to continue your healthcare education and your plan, autism? Did that become kind of like mom/career? Did those two intersect? I feel like that's probably what it is, but
yeah, I mean, I had to go down the rabbit hole, and like a lot of these parents do. I was like, what is available? Because my pediatrician was like, ABA, that's pretty much all we have for you, speech ABA. But I'm like, there's got to be more to this. And so I love to research. I started researching. I came across some really groups on Facebook and some really good research on CBD. And there was a lot of, things. I mean, unfortunately, there was a lot of stigma, but, full spectrum CBD from hemp is non-psychoactive. And there was some really, really great research coming out of Israel at the time. And I thought, you know what? Why the heck not? I'm going to start him on it. Didn't tell anybody about it. And his teachers were like, whatever you're doing with him, keep doing because it's working. Yeah. And so that really, having that experience and not really having a provider to bounce things off of, hey, what do you, or that they, unfortunately, we just live in a very litigious society and a lot of providers are worried about getting sued. I am not one of those, so come see me. If you want to think out the box, come
you heard
see
it right
me.
There. You heard it right there from her.
Yeah. So, but I think, unfortunately, that guides a lot of our medical care in the States is, am I going to get sued? And so many of these things, especially for kids on the spectrum, are very safe. And I would never, ever recommend anything that I wouldn't do for my own child.
100%.
And so that's really what motivated me to get into functional medicine and naturopathic medicine and offer it for kids on the spectrum because so many parents are at a loss, with the biomedical and there's so many options. And unfortunately, there's so many snake oil salesmen. And, I just wanted to be able to be someone that parents could partner with, that they could trust, like, hey, I'm going to shoot you straight. I'm not trying to sell you a cure. I'm trying to give you all your options, risk benefit of everything. And like, let's journey through this together.
Yeah. I love that. And boy, there's so many nuggets there. Like, so I'm going to go back a couple steps here because I don't want to pass up on this. So one, for those of you who don't know, there's an entire community just in the marijuana weed community, just for part of this topic. If you have considered looking down that path, I don't knock it nor support it. It's just a whole thing. You need to do your research on it. But I have seen studies and I have seen children that, oh my gosh, they have found edible pathways that are like, whoa, like kids have totally made 180. In fact, I remember, this is funny. If I'm blowing up your spot on Facebook, I promise you I'm not trying to. I'm giving no names here, but I'm talking in generalities. I remember when we first started in the early years, I remember someone's like, yeah, there's this like secret mom group on Facebook.
Yes.
Okay.
I was part of that. Okay. I was part of that mom's group. Yeah.
So like, they're like this group and it's just moms sharing info. They don't want to get in trouble. So they're like got their own group to be on. And all they care about is helping their freaking kid get help. So it's like a group. So I remember that being something I was like, oh my gosh, this is so funny. It's like TV show. But the CBD side, what I want to talk on that was, we also tried that because they have like 2 variations of it. There's like one that has like 0.2 or something like that. It's like the legal limit and one that has none of it. But I remember we had looked into some gummies, which didn't really seem to work for Taven. And then I had talked to this guy and we had this idea and it never went anywhere. Hey, steal this idea if you want. We had this idea about creating an oral spray. And the idea was like, and I can't get out of my seat here because I to show you on the ground, but like I'd like if Taven's having a meltdown and he's scratching and hitting, and Dad had to be like MMA and put my body weight to calm him down, it'd be like, hey, wife, grab the spray, put the sprays in the mouth, give him the bear hug, and then allow it to like go sublingually under the tongue, right? Get into the system immediately, not having to go orally, right? You obviously know all this stuff. And we just never did it. But that was like one of our ideas back in the day was like, hey, maybe there's a way to naturally calm these boys and girls down, you know, for when the ones that have like Taven who has the high behaviors. But yeah, that's so awesome. So you've done the deep dive. It's had to have been highly emotional for you though, like because every case that comes into your office also is like, you know what I mean? Like, you know, the look on the face, you know what mom or dad are going through. So it probably triggers some memories and some stuff of like, you know, what it's like to be on the other side. I can imagine.
Yeah. Yeah. I mean, I had a family I cried with on the Zoom call last week. You know, I surprised myself. I try to kind of keep it together, but I just felt their hopelessness and, you know, the trauma and just trying to get the best for their kiddo, which he's turning some corners. But as we know with autism, it's not a straight line. No. And it's a little bit of a roller coaster at times. We have ups and downs, and that changes as they get older. There's hormones in play and all sorts of stuff. But through those ups and downs, I really try to be a source of refuge for these families. And that's so important to me too, is to like believe parents, you know, when they tell you what their lived experience is. I feel like so many parents get blown off by their medical providers when they're like, hey, you know, I know this is controversial, but after the vaccines, our kid totally regressed and stopped talking. Believe parents. I also have kids that have never had a single, you know, vaccine in their life. You know, parents use vinegar and water to clean. I mean, they are like non-toxic, super
granola crunchy, all of it. Yep, correct.
And so, but what it comes down to is partnering with these families and believe parents when they tell you, you know, they know their kid the best. And so I really think that that's an important part of working with these families is, you know, I kind of experienced that, got blown off. Overprotective mom, she's reading too much into the behaviors, that kind of thing. So I'm really hoping that with my practice and partnering with these families that they'll feel heard. First and foremost, that they feel heard. Yeah. And then the interventions come after that.
Yeah, Dr. Lem, I love that. That alone is like, I don't think there are parents listening right now that have already been blown off, been in a horrible appointment, and they don't even feel, not to mention maybe even the people around them don't make them feel, so they feel like they're on an island.
Yep, so isolating.
So isolating.
Yeah.
So, because I remember Taven's 17 now, and I remember like the one thing I tell people is, especially from our time period, a lot of your parents would not believe you. I mean, I cannot tell you in the early years how often you talk to another family and they'd be like, yeah, my mom and dad would be like, yeah, you were like that, and that's just normal, and they'll grow out of it, and it's like, mom, dad, no, it's not the same. Like, you're seeing one little element and acting like this is not what I went through. You guys did not. This is not I spank him an extra time and he stops doing this. This is not how that works.
Right.
And it can be so feeling alone, you know.
And society too. That's the other thing. That was the hardest part, I think, going out in public and having meltdowns with the kiddos and getting the stares and the judgment, the silent judgment from other parents and, you know, people out in the community.
Wish you knew how to raise your kid or spank him more or whatever. I was like,
right. And
people,
you know, so you're getting it from all sides.
Yeah. And we're out here trying to just exposure therapy normalize. We just want them to not be trapped in the house. Right. So our one outing for the week that we're trying to get out, and you're making this way worse.
Right. Yep.
Yeah. Yeah. That is really, really awesome. Yeah. The medical community in general, I know that there are very few out there that do what you do. It's not a mainstream thing. Like if you want a diagnosis or whatnot, for the most part, you're going to usually the major diagnostic places, the children's hospitals and different places and whatnot. And for the most part, there's going to be one way they're going to run it.
Right.
And there's not going to be any other options to do it. You know what I mean?
Yeah.
If you were in turn to like let's say they came to you like a hospital and you were to like, they wanted to train on how to better take care of families. We know this may not happen anytime soon. Let's say they did. What would you want to tell, or maybe medical providers listening in or watching our podcast? What do you want them to know about how things can be different in dealing with, the community?
Well, you kind of touched on it before is, sometimes we don't have root cause necessarily, maybe root issues. Maybe we get a couple miles up the stream. Maybe we don't even get to the cause. Sometimes we don't have the answers. But even just taking that extra step and saying, let's run a couple more labs, let's check and see if they have an MTHFR gene mutation that gets poo-pooed in the medical community. But let's take it a couple extra steps and say, how can we support this kiddo's nervous system, their gut, their diet in ways that can support them? Because, you and I might have exposures to heavy metals or molds and maybe feel a little crummy, but kids who have autism, it like exponentially, so it's those kind of things that I think get blown off because we're learning medicine based on normal, pathophysiology. Like your normal, we all get exposed to mold. We all get exposed to heavy metals, I think half the population has an MTHFR variant. So it's kind of one of those things that in the mainstream medical community, they kind of blow it off. But with these population of kids, it really sets their whole body and their brains on fire. Yeah. So that would be kind of my, approach and to not gatekeep it and say, oh, we have, again, it's part of that like corporate medicine, like this is our method or, I think it's so important to just be open to a lot of different approaches because every kid is different. Not one child is going to respond to, and that's another pet peeve of mine is like, I do appreciate these other functional medicine providers that have, supplements and things, but it gets easy to kind of pigeonhole like, oh, if you just start them on this gut cleanse, then, A, B, and C will happen and they'll recover. Yeah. And it's like individualized medicine is so important too. Because what worked for one kiddo may not work for the other kiddo, may not be the issue that they're experiencing. So really making time for that individualized medicine and really kind of taking a couple steps further in your diagnostic assessments and things like that, I think can make a world of difference. Yeah.
And hear what Dr. Lam's saying here. This argument is going to go on forever about the vaccine stuff. But hear what she's saying here, though, when you're just talking about a lot of what the true belief in our industry is you don't have a ton of anti-vaxxers. It's not that the community is, it's that we have decided from data that there is a certain something that is born that has a higher sensitivity. This is what we're all saying. And it doesn't mean you have autism. There are people that just have sensitivities like this, that mold won't impact us. Right. But for some reason, someone that has this, aka autism or some other autoimmune disease, it will shut them down. Like, I've known people with mold toxicity that are like bedridden, and you'd be like, they're faking it. They're not faking it. Why would anyone want to fake that? You're not, it'd be like an allergy. You're allergic to pollen, I'm not. We're walking in the same field. Her throat is closed up, she's hacking and coughing, and I could be like, what's wrong with you? I'm fine. She's allergic to pollen. That is what's wrong. Her body has a sensitivity to it. So you got to be super careful. Like, we're not casting this like broad stroke where we're saying that. The industry is saying that you just got to realize that you got to look at it from all angles. It's probably going to take a lot of different individualized testing that probably modern medicine, is probably, or allopathic's not going to do, that you do need to look at a few of them. And it's not a one size fits all.
Right. Yep.
And that's important to do. And, with these kiddos, like, Taven did a naturopathic route and did it for 18 months. And when Taven did it, he started out with like these 15 vitamins. And then every like week he got another vitamin added. By the time Taven was at the end of his protocol, he was taking like, 70 vitamins. It looked like a geriatric patient, but like it was testing him out. And sometimes we backed off on one, sometimes we added one. But man, the results we got from Taven detoxifying, once again, I don't know all of it. We just were detoxifying things and helping him clear his pathways out. It was incredible.
Yeah.
So I'm sure you see stories like this too that blows your mind.
Yeah. there's things that I'll do with kids, and I meet with the parents 2 weeks later, and it's like totally different kid, and I'm blown away. And I keep my expectations low. I'm like, let's try it. There's an art and a science to medicine. I always tell parents, I wish I had a crystal ball and I could tell you exactly what this is going to do, but I have a pretty good idea. And then it still blows me away. There's times where, we get together. The other, kind of hot topic is leucovorin. I've been prescribing that folinic acid for a little over 2 years now. And that's
you were way ahead of the curve.
Yeah.
2 years.
Yeah, right.
This just hit the news like 6 months ago, like mainstream. You were way ahead of the curve.
And that was kind of a happy accident is because Dr. Fry, he's, kind of the main doctor that's really been pioneering that. He was doing studies here in Arizona. And when I was treating some of his patients at my office that I was at before, when they finished the study, they're like, this has helped so much. Would you be willing to continue to prescribe it for us? I said, let me look into it.
Yeah.
I don't know much about it. So started looking into it, looking into his research. I was like, oh yeah, this is very low risk and might as well try it. I mean, that's pretty much was my approach with it. It was like, this is a very low risk. It's a bioavailable version of folate.
Would you mind explaining a little bit of that? Because people hear that word thrown around, but they may not understand what the actual vitamin is and the deficiency.
Right.
Can you explain that a little bit?
Yeah. So there is a concept where, and not just with autistic children, but with people in general, that there are blocking or binding antibodies that don't allow the body to absorb or utilize folate.
Okay.
And so when you take it,
which is a naturally occurring thing in our body
that we need,
if you have everything normal,
right? That you need, and it helps our neural pathways, and it helps our brain to communicate, and synapses, and all of that. So there's a subset, and there's a couple ways to screen for it. One of it is a FRAT test, as a folate receptor antibody test. That will tell you if you have blocking or binding antibodies. The gold standard is a spinal tap. I do not recommend that.
That's how you have to actually.
Right. So that's the gold standard. However, kind of doing my research, I thought this is such a low risk. I would rather just start at a low dose, trial it, titrate them up as tolerated, and it very, very low side effects. So all that to say is, of that subset, folinic acid, which is the more bioavailable version of folate, can bypass that, and then your brain can actually use it. It bypasses those blocking and binding antibodies. But there's also a subset of kids who have an MTHFR gene mutation, which your body can't process folate either very effectively. And you can either have a mild, moderate, severe version of this. And it's a really easy test, cheek swab. You come see me if you want it. But a lot of providers, in the mainstream community are like, we're not testing your kid for MTHFR, or they go to a geneticist, they don't even run that one. So those kids too can benefit from folinic acid. And what we're seeing in practice is it's helping with receptive communication. First is what I noticed first. More online is what I hear most frequently. Mood regulation and things like that. And then we are seeing more expressive communication. So I quantify that as not only verbally, but being more willing to use their pictograms or AAC device, which is before it was sitting on the shelf, wouldn't touch it. Yeah. Or maybe only use it, at ABA, but not use it at home.
But now open to it.
Right. And so that has been a huge game changer too for families. And I would say, don't quote me on this, but about 90% of kids that we've started on the leucovorin, the folinic acid, have had some sort of improvement. And again, I tell parents, I don't have a crystal ball. I can't tell you, it's not the magic bullet, but it's one of the tools in our toolbox, just like the CBD.
That's phenomenal, though. That's a high rate that you're coming through your clinic.
Right. So, if they're like, hey, they're actually comprehending when I'm telling them, we need to put your shoes on and you have to leave your tablet here because we're going to ABA, and they're comprehending that, and then we're not getting the meltdowns that we were getting before. So even that is such a game changer for parents. And obviously if their kid's nonverbal, they're like, they would love for their kid to be able to speak, but even just having more of that mood regulation because of the comprehension is a win. So I kind of stumbled upon that because my patients were already being prescribed it through this study. And then as I went along, I was like, well, I'm going to continue to offer that to families that are requesting or open to it. And like I said, again, very, very low risk. But unfortunately, there are a lot of medical practices that are under corporate protocols and policies, and they don't feel comfortable having their doctors prescribe it because there's not enough research.
Gotcha.
They feel comfortable.
Yeah.
So that's kind of the bottleneck that we're experiencing with access to that. And again, it's not a silver bullet. It's not a cure all. It's not a miracle cure, but it definitely can be a very helpful resource.
Yeah. And I can speak a little bit to that. I know that some of the people that I know that have used it in Arizona, it is getting approved by long-term care, by access, by all the kiddos that are on through DDD. They are approving it. So like you can get it, but what doc you go to may do it. And I know that the people that I know that have done it, they are getting it in its purest form out of like compounding pharmacies. It's not necessarily like a mainstream. It's like, that's like one of those things. That's where I've seen it from them, where they were getting it.
You can go either route. Dr. Fry is a purist, so he recommends compounded.
Is that it? Okay.
He's a scientist.
Yeah,
I
he wants
appreciate
to
him.
know
He wants it. Yes, he wants it just so.
Yeah.
But that can be sometimes a financial burden for families because it can run $80, $90 a month. You can also get it in a tablet through a commercial pharmacy like a CVS or a Walgreens.
Okay.
Crush it up. It dissolves into water, juice, doesn't really have a taste. And a lot of kids have tolerated that route as well. So
awesome.
Yeah.
Yeah. And the game, a lot of us, we're just sometimes throwing it at the wall.
Right.
And you never know. And the old homage, I say it all the time. If you've met one autistic kid, you've met one autistic kid.
Mm-hmm.
So
right.
10 people walk into her office, it's just not going to be the same thing for everyone.
Mm-hmm.
So you got to start at the beginning and go through. What do you think is like probably the hardest misconception that happens when you're like a naturopath trying to like tackle stuff like this? What do you think you battle the most?
I think people assume that you're against allopathic medicine. I was blessed enough to work at an office with Dr. Bishop, and she's very much a blend of the best of both worlds.
Yeah.
So
true integrative doctor.
Right.
Brings
So
both sides.
I use this analogy a lot. If you are in the hospital and you have a broken arm, and I'm your nurse, and I bring you your pain meds, and you're like, I don't want to take those because it's not going to heal my arm. Well, if you're in an immense amount of pain, your body is not going to heal well. So sometimes we have to use the pharmaceuticals to get the body out of fight or flight, to take away the pain, and then we can get to more of the natural stuff, And so I think a lot of people assume that you're either anti-allopathic or Western medicine, or that you can do everything with supplements and herbs. Sometimes you can't. Sometimes there are some repurposed medications that we use to help regulate. So I think that's probably the biggest misconception.
Yeah, I agree with that. I imagine that sounds about right. Like me and my wife, Tori, we are like you. We're right down the middle. We believe that there's so much good that comes from both sides, and just don't be closed-minded.
Right.
That there could be good in both sides of the fence. And it's probably how it's always going to be. There's always going to be a little bit of both sides. There's definitely a need sometimes from both sides. So like that's a big one that we think is always going to be, the thought process. You can't go wrong with having a little bit of that balance and testing out, because you don't even know. We all have deficiencies, but in these kiddos, their deficiencies are usually like at a higher level, right? We have a deficiency where we take a multivitamin, we add a little something, little groggy, not sleeping well, a little melatonin, a little B12, whatever it may be. It could be like drastic. Their battery on one of these may be at like 1% versus yours 70, going from 70 to 100. So you're a game changer for some of these supplements for these kiddos.
Yeah.
And, Taven's on both ends. Taven definitely has to take some psych meds and a bunch of items. I'd love more than anything for him not to have to take any of it. Like, trust me, we definitely do not want, but that's the tough part about it, is to be able to do. I imagine it probably was a little scary for you stepping out of the comfort zone of just the normal. Like when you did this path, there's a brave move here, I imagine, right?
Yeah. Yeah. And again, like my mentors, I give a lot of credit to Dr. Bishop because she was like, do it, because nobody else is going to do it.
That's
and
awesome.
I'm like, and then you put your toe in the water and you're like, oh, okay, yeah, this isn't as scary as I thought it was going to be. Putting your patient's safety at the first and foremost is how I operate. So like I have the best interest of my patients in mind, and I'm okay with thinking outside the box and working outside the box. If I know that me and the parents are having a conversation, we're going over the risk benefit, everybody's on the same page. Nothing in this world is without risk. So that's, it is, going against the grain is a little bit scary, but it's also very freeing. So it's been a good
mind wide open to like, we're do whatever it takes.
Right. Yeah. Let's get creative.
I love it.
Yeah.
Is there, and maybe this is an automatic no, but you've noticed probably like I have, we have stepped into this weird world of kind of unregulated peptide world is like all around us now. It's like you can't go anywhere with it not being like talked about and touched on. Do you think there's any of these that may touch the autism world that may make their way around? Because I haven't found a ton where I've looked a little bit here and I haven't found a ton. So I'm curious if you have seen some stuff.
Yeah. So I will say there are some peptides available. One of them is BPC 157. It's a gastric peptide. It can help with
so it's so often.
Yeah, so the gut. Yeah. So I mean, I'm not opposed to using those, with my patients depending on the circumstance. Like, hey, this is what we know about this peptide. It is a little bit of the gray area still. But sometimes if there's been something that's been going on for a number of years and, we're not making any progress, then hey, let's try it. I am looking forward to, there's another peptide called MOTC that they've been doing some research with autism on. It's a mitochondrial, it helps support the mitochondria. And so that's another, I think, frontier of medicine, and just in the general population, but also with autism, is that mitochondria and really targeting things on the cellular level as well. So I'd be really interested to see what comes about in the next 10 years.
That's exciting. That's very exciting. I'm jealous of it, right? I'm excited and happy for it, but I'm also jealous of it. Like Taven being 17 now,
right?
He's about to be an adult, and like what people are going to have in 10 years. I'm so curious to know, like, are they going to figure something out that almost like, I have friends that always ask that question. They're like, hey, your company grew so big and you take care of so many kids. Like, what if they cured it? I'm like, listen, if they found the cure, I will be the first person to show up in line. Like, you don't, not even for a second. I won't, there's not even two thoughts in my brain. Like, my son overrides business 110%. I'll be the first person to say, hey, let's roll this thing out nationwide and let's shut down every autism place on the planet. So like, what they'll have, it's going to be a wild world to find out, what it's going to be. I think that something that's wonderful about what you do is I just can imagine that you have a level of like empathy that you bring to the table when a mom and dad are just at the end of their rope. I imagine that you can just see it from the angle that they need someone to see it from, so they're not alone. I can imagine that that's probably a big part of like when connecting with a family. And I'm guessing you don't do the 5-minute appointments. I'm guessing it's more like a natural, but what's that look like? What does it look like when someone comes to you to do an initial consult to like go down this path together?
So the way I've kind of modeled my practice is a little bit, again, of the best of both worlds. So initial visits typically are 30 minutes. I know that a lot of functional medicine doctors, naturopathic medical doctors will do like a very intensive 2-hour appointment. With a kid on the spectrum, first of all, good luck. So I tried to break it up into bite-sized pieces. And I also, my practice is 100% telehealth. So my former practice where I was at, we had a clinic. I would spend a majority of the visit on my rolly chair, blocking the door from kids eloping. And
so
I
true.
was like, how can I make this more comfortable? And I don't do acute care. I'm not listening to lungs or looking at ears anymore. So it's mostly all just functional medicine. So I'm like, I can do this via telehealth. The kids are in their own environment. They're comfortable. The parents are in their own environment. They're comfortable. I can see the kiddo on the screen for like 10, 15 minutes. Okay, go play. You know, it just makes the whole process just so much.
You checked all the legal boxes,
right,
and now you can actually spend time.
Right.
What a cool concept.
Yeah, and break it up into bite-sized pieces. So our initial, you know, I have a pretty robust intake when for their paperwork, what their concerns are. I like to hit on the top concern at our first visit. So what's the top concern? Okay, let's come up with a game plan for that. We're going to work on that for a couple months. Then I'll see you back. And then we'll check in, see how they're doing, make some adjustments. And so on top of being like an empathetic listener, I'm also trying to make it more accessible for families, you know, and doing a telehealth format too. I have families in, you know, Greer and all over the valley that can't get, you know, they would have to take their kid down into Phoenix.
I was going to ask you that. I bet you, what a blessing.
Yeah.
You're in small town nowhere, where therapy doesn't hit. Right. BCBA clinic is nowhere to be found within hours. You don't have anybody to help you. Yeah. And here they can reach out. Yep. And they can get the same level of care in the middle of nowhere.
Yep. And they can get everything shipped to their house, medications, supplements shipped to their house, test kits shipped to their house. I mean, it's that was really my goal, is to be accessible. And to not make it overwhelming. So we take it in bite-sized pieces, and sometimes they just need somebody to listen to them. Some of our visits are just me listening and saying, I'm sorry that you're dealing with this. Yeah. You know?
The testing, I imagine there's like specific labs and things like that. Tests that wouldn't probably be done by the normal pediatrician. Right. That you run for them. So it's kind of outside the box. So that way they're getting some results that they've never seen before.
Right. Yeah. Or sometimes we're using like traditional labs, like at LabCorp, but we're checking cortisol levels. We're checking the kiddo's stress hormones. That hasn't been checked. We're checking their thyroid antibodies. That was never checked.
Because their pediatrician, because of their age, clicks these 7 items that are the standard. Like they're doing their job, like they're taught to do. And you're going, wait a minute though. I know that if this marker and this random marker that may have normally been for an older person, I know that these could actually trigger C, D, E, and F. Right. So you're just clicking more boxes. And
like we're using labs that are covered by their insurance. We're just looking at them at a different light. Or, you know, the other co-occurring condition that happens a lot with kiddos on the spectrum is PANDAS, which is inflammation of the nervous system in the brain from strep. But it can also be from COVID and all sorts of other things, Epstein-Barr. And so I'm like, has your kid had strep lately? They're having some new onset symptoms, like some anxiety and OCD that aren't typical for them. And a lot of providers would be like, well, they're autistic. But it's new for them, you know? And I'm like, well, let's run these strep antibodies. Let's run some inflammation markers through the roof.
Through the roof.
And parents had no clue. They're like, oh, we didn't think he had strep. Well, his antibodies are through the roof, and these are new onset, you know, symptoms, so we should treat it. So it's things like that, you know, unfortunately these kids kind of can slip through the cracks. And it doesn't have to be thousands of dollars. Like I try to keep everything. I'll only recommend specialty testing if I think it's absolutely necessary. Yeah. And, you know, I'll utilize their insurance. I'm a cash pay practice, but I will utilize their insurance for medications, labs, as much as possible. Because, you know, I'm a middle class mom myself. I don't have thousands of dollars. I didn't have thousands of dollars. And so I really try to make it as accessible as possible for families.
I love that. Mm-hmm. Something you touched on there that is a much bigger topic than we have time to go into, but I am going to let you guys have a little piece of this because it's important, and we'll have to do more of it at a later time. But PANS and PANDAS is a huge one that when you step into the kiddos having like behaviors, that they are one of the things that a naturopathic holistic approach would be like, the reason why they're having this outburst and what their body is on fire because of this level of information. That strep to you is it's uncomfortable. Like no one likes strep throat. Everyone hates strep throat. Imagine though, if that strep throat, if the strep virus was in your whole body to your brain, and you're on fire everywhere. And that is kind of, I'm shortening this. There's much more to it. And we went down this path later on, finding out, it was like clockwork. If Taven was like extreme, you almost knew someone was sick around him. Like if you checked everyone, a caregiver, a family member, he couldn't get sick like we got sick. Were like protecting Taven like the president of the United States of America. Like he can't be sick, because for him, for us it was a cold. For him it was like, ooh, we were gonna have a bad couple weeks.
Yep, exactly.
So that's one of them that maybe if you're listening or watching online, you may not know about this. Definitely something to go down. And obviously we're going to give information for the doc, so you can definitely see her, and now its ability. And ours did the same thing, and I love that about the model, where the insurance still can cover some things, and it works out beautifully to where both sides can come together. And I love that about it, so that way they can do that. Mom and dad just get the diagnosis. Talk to me about first steps. What's the best thing that can be done right out the gate when you just find out? What would you tell them in order of?
I think connecting with the community. So whether it's your church, if you have, because like you said, it can feel very lonely. And even people in your family, you might feel a little gaslit by them, like, oh, are you sure? So finding your tribe is really important. And whether that is maybe through your faith community, SARC is another really good resource. There are parent advocates. That is a lifesaver that can walk you through how to do an IEP and how to advocate for your child. And then, places like Arizona Autism, call them, walk me through because it feels so overwhelming. And even just managing insurance and like what covers what. And it can feel so overwhelming. So really finding your community and walking with people who have walked that path is, I think, the best first step that you can do.
I love that.
And then everything else kind of comes after that. And I know as moms particularly, this has kind of been my mantra. P90X, I'm aging myself. P90X was like this exercise routine.
I know P90X too. Yeah.
Tony Horton, he used to say, do your best and forget the rest. And so that's been my mantra as a nurse practitioner, as a mom. It's like, we always feel like we could be doing more. And as parents, we're always, we always feel like we're maybe falling short. Like, and there's a lot of like, again, with the diagnosis, like, oh, we should have done this, or, is it because I took this medication when I was pregnant? I you want to go through all the, could have, would have, should have. And it's important to just come to a place of like acceptance and say, okay, this is where we're at. Hold everything very loosely. That is something that God taught me with my first labor and delivery. Like I had a whole birth plan, everything went sideways. And so it's life is like that. And even with our children's autism diagnosis, is like we have these preconceived ideas of what our kids' life is going to look like before and after their diagnosis. And so holding those things very loosely, but still supporting them to live their best quality of life. So do your best, forget the rest would probably be my, Tony Horton mantra for parents, but also just connecting with the community around them that can help support them through that process.
Yeah, that's so good. You're gonna go on a roller coaster of emotions, and you're gonna sometimes feel like you're on a boat by yourself, just out there going, there's no way someone else is going through this. Like there, no way other kids do this to their parents. No way this happens 3 months in a row every night. And I think that the thing I tried to hold on to similar was that sometimes seasons, the bad season, would last so long that I would forget that when I left out of them. Like all of a sudden we'd be like not doing it anymore. And it was like, oh, we're not even in that season anymore. So just know that there's an ebb and flow to this, the seasons of what may be the diapers or the fecal smearing or the biting or the scratching, just know they have an ebb and flow. And when you're in it, don't get so constricted to think, life is over. This is terrible. There's no hope.
Right.
Don't think like that. It's going to feel like that. And that's where you're saying, have community, have something to lean into. If faith is your thing, lean heavy into it, because you got to know that it's just a season and this too will pass.
Yep.
It's a tough one.
Yep. Just hold everything so loosely and, one day at a time.
Yeah.
One day at a time.
For sure. Yeah. For you, your son now, what's your guys' relationship like? How's he doing?
He is fantastic. I joke he's my golden retriever. I have he's my oldest, and then I have a younger one, who's my little Sour Patch. But he is just the sweetest kid. He really goes out of his way to take care of other people. He's very high functioning now. So, they got rid of this diagnosis, but I would probably put him in like an Asperger's type category now. But, he still struggles the social emotional stuff. It's a different struggle than profound autism, and that's a whole nother topic.
Yeah.
I am not claiming to even know what that's like.
Yeah.
We were definitely in some dark places, but now that he's older, he's definitely higher functioning. But he's a super sweet kid. But we do see some of that misunderstanding in the community, or him not understanding. He's so pure in heart.
Yeah.
That
it's just a different struggle.
Yeah, he's just so pure in heart that he can't even fathom anybody having ill will toward him, or he gives everybody the benefit of the doubt. He's so trusting. He's such a sweet kid. He's so sensitive. And he really enjoys taking care of the school he's at. They have grades first through high school. So he's really liking the leader. He's in leadership, and he's liking to be able to kind of mentor the younger kids. So, and he's been able to kind of share with these younger kids, like, his diagnosis and his journey and the things that were hard for him when he was that age. So it's been really cool to watch that happen too.
Yeah. I love that. And I explain to people all the time, the struggle is not worse or better. It's just different, because you're not understanding. On one side, you'll have a side that there's a lot of guys. There's so much arguing online about this. And I wish people would not do it, because I hate it so much. Because in some respects, like in the medical community, we wish actually they divided it up, so that way they called it two different things because of this fighting, which is that we hate. But one side has this set of struggles, and the other side is there's not the support and understanding. So the level of bullying, the level of taking advantage of, the danger that happens to the other side because of that, you're not understanding. These are equally not good. There's a beauty about both sides. Don't ever take my words. I know sometimes people comment about stuff like this, about thinking I'm woe me and it's so terrible. And I'm not saying that. I love my son. We have some amazing things, but the struggle is, who as a parent wants their child to struggle?
Right.
Nobody wants their child to struggle. You love this child more than anything in the world. You don't want them to struggle. Wouldn't matter, neurotypical, high function, low function. No one wants their kid to struggle. So we're just expressing that as all as it is, and just wanting the best for our children. But it's true. Even now, as Taven approaches the older, and as your son approaches it, we're just now in a spot where the pediatric is really got a heavy focus. So now they haven't even caught up to where a lot of kiddos, when they graduate, there's almost nothing. By the way, if you don't realize that, there's a whole season that's going to come in this world where there's going to have to be a financial help that's not really being talked about right now for what does it look like for the country to take care of autistic people as adults. We haven't even cracked this code yet, by the way. So if you don't know that, right now, they're all just living with mom and dad forever.
Right.
It won't work like that. As the future numbers have gone, it won't work like that. There's some changes coming. But for the most part, when a kid graduates high school, you hope there's
It's like aging out of the foster care system.
It is. And I saw a study, and I don't remember where it was or what it was, but it was a study based on the percentage of homeless people that had either undiagnosed or whatnot. It was scary when they did like they did a carve out when they were doing it. I was like, whew. But I hope you guys have enjoyed this episode. It has been an absolute pleasure to have you. We're going to have Dr. Lamb, all of her info down at the bottom. Please reach out. There are very few people that do what she does. So this is a treat. So her info will be below. I'm super thankful to have you on the show. We could have talked for 18 hours, by the way. There's a lot more, but you got to pay her for her time. So you reach out to her and be able to go deep on this because it's worth it. As always, please make sure you guys subscribe, follow, click, share. There's a family somewhere in the world that doesn't have access, that doesn't have the ability, and we just want to give them the same access that like a major city would have, where they do have the ability to stay on the cutting edge to help their child. Because that's, with the autism community, it kind of becomes your whole world ends up centered around this one topic in your family, and help is help, and we're here to do that. As always, we're a faith-based podcast. So the last thing I do always is I'm going to pray over this amazing lady right here before we go. So, Lord, I am so thankful for her life. I'm so thankful the gift of her son and the abilities you gave her to impact and heal and help and change not only her family and his trajectory, but everyone she comes in contact. I'm thankful for the gift that you led her to come and become this specifically like integrative health practitioner. What an amazing gift to fill a gap that is needed at such a level. So thank you so much. Bless and protect specifically her practice, give it longevity and success, and allow it to just help so many families that are out there that feel lost and broken. It's in Jesus' name we pray. Amen.
Amen.
Thank you guys. See you guys next week for another episode of Autism Life Today.